Hello, my name is Nathan Sun. I am a senior in Shaker Heights High School. This is my first year in the radiology internship program. And the name of my topic is Evaluation for Discrepancy Between Radiology Biopsy Procedure Reports and Pathology Reports, Complications of Biopsy and Evaluation of Indeterminate Biopsy Reports. So my question is, are radiologists at Hillcrest Hospital being more and more aggressive with CT-guided biopsies, resulting in additional procedures, tests, and morbidity as a result of inadequate pathology results? Background. Some radiologists are performing CT-guided biopsies with taking more and more number of core biopsy specimens from a single patient because of prior pathology reports that indicate insufficiency of samples with an indeterminate result. Inadequate samples means additional biopsies. This means more risk of complication. Furthermore, additional biopsies results in greater patient exposure to radiation. The annual radiation received per person is 360 milligram. An average CT chest scan is 700, while an average CT chest scan of the abdomen and pelvis is 1,000 milligram. In addition, it has been noted that in some cases, the number of core biopsy specimens submitted by the radiologist is different than the number of core biopsy specimens but reported as received by the pathologist. Friable cores account for an increase in number of specimens received, but not a decrease. The objective of this research project is to determine if radiologists at Hillcrest Hospital are taking too many biopsy samples. The second objective is to find out why there exists an inconsistency between samples sent and received. The overall goal of this project is to improve the rate of definitive biopsy results. Hypothesis. Radiologists at Hillcrest are pursuing an overly aggressive biopsy procedure that compromises patient well-being. The number of specimens submitted by radiologists does not match the number of specimens received by pathologists. Methodology. Any CT-guided or ultrasound-guided biopsy procedure was examined from December 2010 to May 2011, a total of 170 cases for indeterminate result and discrepancy between the specimen obtained and specimen received. The reason for indeterminate result was recorded. Any relevant data was entered into Microsoft Excel for analysis. So out of 170 cases, 13 cases had complications after biopsy. Of the 13 cases, 1 was severe. "42 procedures out of 170 ended in inadequate result or poor biopsy sample. And out of these 42 procedures, 23 require additional procedures or biopsy. Out of 170 cases, 19 procedures had discrepancy in specimen submitted versus specimen received. 131 procedures matched, while 20 were unknown. Data analysis. 8% of procedures ended in complications. 32.8% of all biopsies resulted in poor specimen or inconclusive diagnosis. Out of all the biopsies performed, 11.1% had differing results between specimens submitted and specimen received. The expected result for the discrepancy between specimens submitted and received is 0%. The unknown section in the discrepancy graph is derived from radiologists' report that state multiple cores were fine needle aspirations taken instead of a specific number. Furthermore, in some radiologists' report, the needle gauge is not stated. Conclusion. The procedures that had complications were independent of lesion size. The size of the masses ranged from 1.6 to 7.5 centimeter. Complications are always a risk for biopsies and develops regardless if the procedure was done without fault. In 42 cases, 32.8% of all procedures ended in inadequate sample size or inconclusive result. It is not advisable for radiologists to take more samples during a biopsy due to patient safety. Recommendations. Since the missing information regarding number of specimens taken became an obstacle to the accuracy of the project, it is recommended that radiologists be required to enter the specific amount of cores and fine needle aspirations taken during the procedure. Radiologists should mark all core samples with a marker to clearly indicate to pathologists the number of specimens. A new study with a larger sample size should be conducted. The findings of this report could be compared with those of other hospitals. Special thanks to this list of people: Dr. Virginia Hill, Jackie Dixon, Molly Loney, Nedra Starling, the Office of Civic Education's Initiatives, and Rosalind Strickland.